Hello friends, welcome to our channel. In medical coding interviews, one of the most important concept they will ask is what is the difference between Profee versus facility coding. So it is very important to learn difference between Profee and facility as coding differs from Profee versus facilities. So in today's session, we are going to learn what are the differences between Profee and facility. Basically, what is Profee coding and what is facility coding, and also how to answer in interviews related to Profee versus facility medical coding. So, my name is Harish Gupta, currently working as a ambulatory surgery trainer and content creator for Passcoder 21 free medical coding YouTube channel. Always my intention is to share knowledge, gain knowledge. So, in my channel, you will get latest information about APC, local chapter, webinars, medical coding jobs in India, USA, UAE. And also, if you would like to join in our WhatsApp group, I have mentioned our WhatsApp group link in the description of this video. Please join using that link where you will get latest jobs in India, USA and UAE. As all of us know, medical coding is very important for reimbursement process, where patient will get their reimbursement or payment based on the work they have performed. In medical coding, all coding types are not same. So we are having different types of medical coding process. They are professional fee coding and facility coding. For professional fee coding, usually we will call it as Profee coding. So if you are working as a medical coder or if you are planning to work as a medical coder, you need to understand the differences between Profee and facility coding in order to code accurately and in order to know the client reimbursement process. So what is Profee coding? So Profee coding refers to coding of services provided by the healthcare professionals. Most commonly, physicians or healthcare practitioners. Usually, you will call it as QHPs, qualified healthcare professionals. In Profee coding, most of the time, we will code based on the physician's professional services, where using the professional services, physician will identify the patient diagnosis as well as the treatment. The coders who will work in Profee coding will use CPT codes for procedure services along with ICD-10 diagnosis CM codes for diagnosis or medical necessity related to CPT codes. So in Profee coding, just you need to remember that here you will code for the physician's professional services. Okay, that is the very important keyword you need to remember. Professional means here physician will use his experience and his knowledge and his education in order to treat or manage the patient's condition. So what are the few examples of Profee coding? So annual wellness visits, consultations, procedure in a hospital operating room and EKGs. For example, if a doctor sees the patient in annual wellness visit, it will come under Profee coding. If a doctor performing a consultation in outpatient clinic, it will come under Profee coding. If a cardiologist interpret and reporting an EKG, it will come under Profee coding. So basically here patient will use his professional knowledge. So what are the key features of Profee coding? So these Profee coders will use CPT codes. Most of the time these CPT codes will be used by the Profee coders in order to code procedures performed by the provider. And also in Profee coding, most of the time Profee coders will use modifiers like modifier 25 or modifier 52. So based on the requirement. These modifier 25 and 52 are only examples. Other than these modifiers, Profee coders will use more number of modifiers. If you want complete video on modifiers, please check our YouTube channel. Most of the time, Profee coding will depends on outpatient setting. In Profee coding, reimbursement is based on the physician's work and typically will separate from the facility. As we have discussed, facility coding is different than the physician coding. So now we will learn what is facility coding or about facility coding. So what is facility coding here? Facility coding refers to the coding of services rendered by a hospital or outpatient facility. Most of the time, facility coding captures resources such as nursing staff, supplies, equipment, and rooms which are required for patients' care. Most of the time, facility coders will use ICD-10 PCS codes for procedures in inpatient setting and CPT codes for outpatient setting. And ICD-10 CM is common for both Profee coding as well as facility coding. So what are the few examples of facility coding? For example, patient is admitted as a inpatient, okay, in a facility, where here physician will use or facility will provide operating room, recovery room, and board and continuous general nursing services in order to treat the patient's condition. Or if the patient needs to stay overnight. And one more example is an outpatient surgical procedure where the facility provides the operating room, recovery room, and nursing services. And most common example is emergency department, where facility will charge for use of ER. ER means emergency room, labs, imaging, and supporting staff. So what are the features of facility coding here? So most of the time, facility coders will use ICD-10 PCS for inpatient service, where coders will use ICD-10 PCS for procedures performed in the inpatient setting, as well as CPT coding for outpatient setting, where coders will use CPT coding system for outpatient procedures. Now we will learn few important differences between Profee and facility coding. So first we will know about the purpose. So what is the purpose of Profee coding? Which captures services performed by the provider. Otherwise we can call it as physician. Okay. In facility coding, which captures resources used by the facility during the patient's care. In Profee coding, we will use CPT and ICD-10 CM diagnosis codes, whereas in facility coding, we will use ICD-10 PCS, CPT as well as ICD-10 CM for diagnosis. Most of the time, Profee coding focus on physician working like consultations, procedures and interpretations. In facility coding, the focus will be on facilities resources like supplies, nursing care and equipment. In Profee coding, reimbursement is based on the professional services. Okay. In facility coding, reimbursement is based on the facilities resources and services users and nursing services. So now we will learn few tips for Profee and facility settings. Whether it is Profee coding or facility coding, we need to master the code sets. As we have discussed previously, in Profee and facility, we will use CPT, ICD-10 PCS as well as ICD-10 CM. And we need to understand modifier usage. So how to apply the modifier appropriately whenever we code the services. And always we need to stay updated with latest coding guidelines. So thank you friends. Thanks for visiting our channel. If anyone looking for same-day surgery coding training or SCC training, please send WhatsApp message to 707-526-3939. If you like this video, please click on like button in order to motivate me, and also comment and subscribe to our channel. Share maximum so that other people who are planning to attend interviews, they can utilize this video in order to clear the interview without any fear.